Good morning. I should call this series Half-Assed Pilates because we're still in my studio that is perpetually being worked on. But anyway, that's okay. We continue on. I wanted to work on a chest opening series and explain it a little bit for my people who are, like myself, managing pectus excavatum, right, or sternum cavity compression, whatever terminology you want to use. It's very difficult for those of us with a caved-in sternum to open that space up without popping out the lower ribs, right? Because that's where more flexibility is, so the body will use whatever avenue it needs to get the job done. Okay? So one of the things you want to really work on is keeping the middle back, right? Keeping this space here anchored on the ground, so you're not arching your middle spine up. You might have a little bit of space in your lower spine, and that's fine, because that's where the lower back arch comes into effect. The vertebrae are bigger. That's what sometimes is referred to as a neutral spine or a neutral pelvis. Okay, I am going to face away from you so you can see that particular point of view, and then I'll also show you a side version. Okay, so I recommend that you look first and then follow along, but again, you do whatever you need to do for your body. That's the name of the game with this type of practice. So we're going to start lying down. If you're in New York in an incredibly hot room, okay? And just take a moment to let your pelvis rest on the floor, to let it settle. I'm probably going to have to move some very adorable doggies out of the way in a second. All right, see if you can feel again that little lower back arch right underneath your belly button. Don't flatten it, don't extend it. See if you can feel the middle of your spine on the mat or on the ground. All right, the space between your shoulder blades resting on the ground. And a little arch away from the floor right underneath your neck. Okay? Now, you don't want to disturb those natural curves of the spine as we bring our arms up. We're just going to take a moment to bring our arms right up over the front of our chest wall. And think about the long arm bone, the humerus, dropping down into the cup of the shoulder socket. So the long arm bones are nice and heavy. The fingertips are reaching up. You have an oppositional extension. And you can just play with moving your arms around their sockets. This actually feels really nice. Again, we don't want to lift the shoulder blades and the collarbones up towards the ceiling. We just want to kind of think about the head of the humerus, the long arm bone, just like circling around in its socket. For any Pilates practitioners, you may be familiar with the concept of single leg circle. This is like a single arm circle. Right? So we're just gliding the arm bone around in its socket. And this has multiple applications for people with all kinds of shoulder issues, but we're talking about pectus skin, right? Opening up the chest. Now we're going to do something called ribcage arms. So all that is a practice of extending the arms back without arching the spine away from the floor. And the goal is not to reach all the way behind you, but to keep the middle of the spine, again, in contact with the ground. So you're not using the back to move your arms. You're using the shoulder girdle to move your arms. And then again, you can let this evolve into a larger arm circle. Checking in to make sure, right, you can play with it. checking to make sure that you're not, again, lifting the shoulder blades up away from the mat, and you're not reaching back and letting the spine lift up, because at that point, again, that is a back movement, and the back does not move the arms. Now we're going to come to a goal post or hostage position. All right, stick them up. And for some of us, I mean, I am very tight in my pectoral muscles, right? I have a pretty severe pectus that I have chosen to not at this time correct with surgery. Excuse me, cute little white dog, go over there, please. Darwin, go lay down. That is Darwin. Darwin, go lay down. All right, so as I was saying, I have a very strong pectus. So it's not possible for me at this time to bring my forearms or my elbows onto the ground. Again, we don't want to let the spine arch away from the mat, because then it becomes a back movement. The back does not move the arms. So this is going to be a pretty big stretch across the chest for some of you. Okay? Just breathing into your belly, breathing out. And then we can play with this if you want to increase or decrease the stretch depending on where you're tight. You can pull your elbows down. You can let your elbows and your arms float up. This is always a very hard one for me because I'm also a little kyphotic, right? I have a little bit of an increased upper back curvature. And then to finish that off and to kind of release it, extend your arms out to one side and just do a little rotating, turning the opposite palm down, rotating through the cervical spine, other arms. And then just, shake your shoulders out, roll over to one side, and ease your way up. So I'm actually going to keep quiet now for the second part of this, okay? And I'm going to give you the side view. And hopefully adorable puppies will not get in the way, like this adorable puppy. Sir, let's point you in that direction. Thank you. That won't work for very long. So again, here we are, right? Not allowing this large space to happen in the middle spine. So lower back coming down into that neutral position. Hello, baby. Okay. Bringing your arms right up over so you're in a straight line. Okay, and I said I was going to be quiet. And that's what that looks like. Very simple, right? Could you do this post surgical correction? Absolutely, as long as you speak with your surgeon who's going to talk about what's appropriate protocol after there's been any adjustment. Could you do this pre-op? Yeah, totally. And in fact, for some of you who are a little older, such as myself, I'm 54, sometimes the ribs, right, they're going to become very inflexible. Okay? And so you want to give your shoulder girdle, your rib cage, as much movement as possible prior to surgery, right, to assist with a more positive outcome. I hope this was helpful. Please feel free to comment, and that's all for now.